Like many of you, we are following the guidelines to stay home as much as possible. Anthony's in his library, I'm in the family room, and Tony's in his basement. But this is where we begin. Despite the relentless rise in coronavirus cases and deaths, more states are beginning to reopen. As of today, at least 12 states have started relaxing restrictions to allow some businesses to open their doors in a limited way, they say. That includes Georgia, where the decision has faced widespread criticism, including from President Trump. Anthony?
California has not loosened the rules, Gail, but thousands still packed beaches in Orange and Ventura counties, which were open over the weekend. Locals say the large crowds resembled those seen on the 4th of July. California has the 5th most confirmed cases in the country. The danger is still very real. In just the past 4 weeks, the death toll in the U.S. has jumped from about 2,500 to about 55,000. That includes an increase of about 14,000 since this time last week.
Dr. Vivek Murthy fought Ebola and Zika as the 19th Surgeon General during the Obama administration, and now he's talking to presidential candidate Joe Biden and local leaders about how to tackle the coronavirus. He also wrote the new book, Together, The Healing Power of Human Connection in a Sometimes Lonely World. Murthy believes togetherness can help solve many of our problems, and Dr. Murthy joins us now from Miami. Dr. Murthy, good morning. What a timely book. But speaking of timely, your expertise as a public health expert, also very timely. So I want to begin there. You've been advising state and local governments on this question of when to reopen. What are you telling them?
Well, it's so nice to be with you this morning. What I'm telling people, whether they're elected officials or reporters or anyone who will listen, is that it is important for us to reopen as quickly as possible, but to do so safely. And that means at this point, first and foremost, that we have to have much more expanded and available testing. We then have to follow that up with the contact tracing that can help essentially drop a net over new cases when we find them. And if we have these in place, along with the surge capacity we need in hospitals, then when cases finally start to dip down, then we can safely start to reopen with cautions. We will still need to keep distance from each other. We'll still need to ensure that we're wearing masks in public, but we'll at least have a fighting chance at preventing a second surge.
With those guidelines in mind, how do governors and mayors balance the known health effects of unemployment and loneliness with the known health effects of the virus in this pandemic?
Yeah, so this is an unprecedented situation that we're in, and I appreciate that there are really tough choices to make here. But one thing we have to avoid is the false choice between people's health and the economy. If we really want to get the economy back up and running, if we want people to not lose any more than they've already lost, we've got to make sure that we are taking care of people's health and that we're making it safe. If we don't do that, if we reopen prematurely, then what happens is we will have another surge and everyone will have to retreat back into stay-at-home measures, which will actually hit the economy even harder later on. But as much as people talk about the economic impact, which is serious, and the direct health impact, which is real, there's another impact that we haven't talked about as much, and that's the impact on our social lives. As I worry about it, it's the social recession that we may incur as a result of the prolonged physical distancing and fear of the virus that may deepen our loneliness over time, and that has real consequences for our health as well.
Yeah, one way to mitigate that social recession, as you call it, is to ramp up testing. Dr. Anthony Fauci of the Coronavirus Task Force says we need to double testing, and he thinks we'll be able to do it in the weeks ahead, diagnostic testing, that is. What would that testing system look like? How would we experience it as everyday Americans?
Well, what it would look like is our ability to, number one, get tests to whoever needs them, so particularly people who are at higher risk, healthcare workers, the elderly in nursing homes, frontline workers who are working in grocery stores and in other jobs where they're in constant contact with people. They need to be able to be tested whenever they require it. And second, it would also look like doctors being able to get tests for anybody who has symptoms. That is still tough for many physicians now. And finally, it would look like rapid turnaround of tests. Right now, there are still clinicians who are having to wait 3, 4, 5 days to get test results. We need to shorten that to the rapid point-of-care test, which can deliver results within minutes.
Dr. Murthy, you've got a book out right now, or actually tomorrow, called Togetherness, at a moment when togetherness is the one thing public health experts like yourself say we can't engage in. So loneliness is a problem. How do we combat it at a moment when we can't reach out and touch someone?
Well, this is one of the great conundrums of today. And if you had told me a year ago when I was writing this book on loneliness and social connection, a book that was inspired really by the conversations I had with people around the country when I was Surgeon General that showed me that, in fact, loneliness is far more common and has far more impacts on our health than we think. I would have thought that, gosh, that we would never be in the current situation that we're in, where we're asked to physically distance from each other. But here's the truth. We can choose one of two paths that we go down now. We can either allow the current physical distancing to deepen our separation from each other and increase our loneliness, which in turn has long-term impacts on our increased risk for heart disease, dementia, depression, and anxiety. Or we can go in the opposite direction and say that we are going to use this moment to reset our lives, to recommit to making relationships a priority in our lives. And there's some simple steps that we can take to do that right now, even though we don't have the ability to see each other in person. And that's what I really go through in this book. I was inspired to do it really by folks who taught me that as a doctor, we see lots of illnesses like diabetes and hypertension in the hospital, but this is one that we have not been paying enough attention to.
I think that's right, Dr. Murthy. And I was going to mention two of those tips in the book, one of them being take time every day, 15 minutes to connect with the people most important to you in your life. And second, when you do that, make sure you focus. Don't have another thing going on. Don't be cooking at the same time. Just one-on-one connection. So important as a reminder right now. Dr. Vivek Murthy, thank you very much. And your book, Togetherness, it goes on sale tomorrow. And you can hear more from Dr. Murthy about the fight against loneliness on today's CBS This Morning podcast. It's available wherever you like to get your podcasts.